So Kevin will present, and then Grant, you have to think to advance, or
Yeah.
you can do it with the mouse.
All right. So this is a 11-year-old boy. He comes into Dr. Cohen's office with the chief complaint of having difficulty reading. I guess he just expressed to his parents he was having some more trouble reading and seeing out of both of his eyes. He has no significant past medical history or past ocular history. It's kind of hard for him to articulate his symptoms, but it sounds like symptoms have been present for at least a week. He's not sure when they started, and the symptoms are constant. And then there's no significant family history of any ocular problems, retinal diseases in the family. In terms of vision, he's 20/25 in the right eye, 20/40 in the left eye with normal eye pressures. So pretty limited history, you know, it's an 11-year-old kid. And here's the first photo.
All right, so we have a color fundus photo of the right eye. The vitreous looks clear. Disc looks flat, pink, sharp borders. You have that normal pediatric sheen to the retina. And then my attention is drawn to the fovea and parafoveae. There looks like there's some light colored lesions surrounding the fovea with like a center dark area, maybe some pigment in there. Otherwise, the rest of the vessels look normal in the outer periphery.
And so here's the next eye, left eye.
So color fundus photo of the left eye, very similar findings, those scattered light lesions with dark centers kind of accumulating in the fovea.
Yeah, and I think this was the eye with a little worse vision. Okay. This is IR.
So we have IR of both eyes, and then attention is drawn to the fovea again. So those lesions look like they're hyper-reflective and sort of confluent, maybe like a pisciform shape or almost like a web starting to form when the confluence of those lesions.
They flow into each other on a random. Oh.
Code 3, please, code 3.
All right, moving on.
And then is this autofluorescence?
Yeah, this is autofluorescence.
Yeah. So it looks like there's some hypoautofluorescence concentrated in the fovea, and then maybe some rare hyperautofluorescence in a few of the outer lesions.
Yep. Basically, just corresponding to those, you know, lesions we saw with the colored photos.
And then we have OCT in a retina, looks normal foveal contour. And then in the outer retina, in the fovea, there's some outer retinal disruption, IS-OS junction disruption, and then maybe even a little bit of RPE atrophy too.
Yeah, absolutely. These little focal spots, subfoveal.
And then this must be the other eye. So kind of
I think it's the same line.
same eye as a vertical cut, perhaps. But again, we have outer retinal disruption, maybe not quite as prominent here.
And just like maybe a little hypertransmission here, which goes along with what you said, maybe some RPE loss as well.
And then here we have the left eye, again with the subfoveal outer retinal disruption.
Yep. But otherwise, pretty normal looking inner retina, normal. So I think we just have a lot more images here.
So here's another cut, and it looks like there's a very sharp demarcation in the cross section of some hyper reflectivity. And the kind of centered in the fovea.
So real quick, I'm gonna back you up. So read just real quick. This is an 11-year-old kid that came in with just difficulty reading. This is the right macula. This is the left macula. And then this is the IR. And then this is the autofluorescence. Now we're doing the OCTs.
Thank you.
I wanted you to see this one. This is like one of the good ones.
I think we can move on. We're showing different cross section here of those hyper reflective areas. Where we see those focal areas of outer retina, RPE, continuation loss. Let's go along. I think there's 51 slides in this, so. Okay, so yeah, summary of findings, 11-year-old boy coming in with difficulty reading, doesn't give you much history, you know, when you ask him about flashes, floaters, not really able to articulate on that. DFE, you see these multiple discrete yellow, white circular spots, perhaps scars scattered throughout the macula, parafoveal region, and the spots are hyperpigmented centrally. On IR, we see hyperreflective spots corresponding to these areas seen on the DFE. Autofluorescence shows hypoautofluorescent spots, and the OCT shows these focal areas of outer retinal layer loss and disruption with underlying RPE loss. So any like thoughts?
The kind of shape of the lesions is kind of pisciform, so Stargardt's comes to mind. But I think they typically have more hyper autofluorescence, and then also like a pattern dystrophy or maybe like a butterfly dystrophy, something like that.
Then we recently had that eclipse a couple of weeks ago.
Okay, maybe some
So
solar
yeah, so
retinopathy.
This spot, this scan right here, this, like that cut right there, the outer retinal. If you just had that image, there'd be a differential for that, which would include solar. Do you know what the other stuff is for that?
Laser.
Laser. There's a couple more.
Do we have achromatopsia last
Which
time?
Oh, achromatopsia, you could do that. That's good. This is something you see with poppers.
Oh.
It's Popper's maculopathy, which is the animal nitrate or something. You pop it, it's supposed to be good for sex, I guess. And then never tried it. And then Mactel often disrupts the outer retina.
Okay.
So if you have this weird outer retina, and then I guess you'd put Mactel and you'd have to put in tamoxifen retinopathy. And then a stage 1 hold, but you expect some traction. So this little disruption of the outer retina is fairly limited differential.
Yeah, so I had a couple of those. So the laser, solar eclipse, acute idiopathic maculopathy. Like there's other types of exposures for phototoxic maculopathy. In fact, like it's thought that like surgeons and patients can get like a type of phototoxic maculopathy from the scope if you're just like your fovea is fixated on that light long enough. So like when you have the patient looking at those 3 lights during cataract surgery, if they're actually fixated on it too long, there's like theoretically they could develop like a type of maculopathy from that. But the good news is most often that it resolves, it's transient. And then like Grant said, early Stargardt's disease. And then I did think like VMT, early macular hole, but like you were saying, you'd notice some like tractional changes to that. And then just perhaps with like those little spots like opposed, but you know, with the OCT, not as much. And the reason I included this, just these are kind of all grouped. They cause focal disruption of the ellipsoid zone and RPE loss. So what we hypothesize, or what Dr. Cohen hypothesizes, is that this little boy was exposed to a laser. And in fact, when the parents were questioned, it sounds like they had recently bought like one of those heavy duty industrial strength lasers.
Yeah. Yeah, they just bought him one for about a couple months ago for his birthday, which he's a 10-year-old, right? 11, yeah. Yeah, so when you buy a kid a laser pointer, the first thing you say is don't point it in your eye, right? And then if I was a 10-year-old boy, the first thing I'd do is go in my room. Shoot it. You know, because that's what boys do. Boys are so.
For sure.
Yeah.
So, yeah, what
He
is
still hasn't
laser?
admitted to it. I saw him a
Right.
couple weeks ago. He still hasn't admitted.
Yeah, and we have the follow-up photos too. Yeah, he does not admit to it.
You have to put them on the rack and
Yeah.
toothpicks under the fingernails, they'll admit to it.
So obviously, result of direct laser injury to the retina. It's most often unilateral from accidental exposure, but obviously you're shining the light in both eyes, it's bilateral. Unfortunately, there is increased incidence of laser maculopathy with increased availability to these heavy duty industrial strength lasers. The incidence
This is a
is-
laser pointer though.
You'll see which one it is, though. It's
it's
interesting.
doubled since 2014. The good news is prognosis is generally favorable. Most patients will recover to 20/20 vision, but depending on how much exposure they get and how strong the laser is, you
Did they
can
take the
have,
thing away from him, or is he still going?
Yeah, they took it.
Good.
so you can
Poor
have
parents. They were very
permanent
caring.
scotomas, visual field changes. And no surprise, young men, kids, and kids or people with mental disabilities are affected most often. And it's, so these type of laser injuries are typically caused by class 1A or higher lasers. So there's a classification for that. It's the overseer is OSHA, Occupational Safety and Health Administration. So there's 6 different categories for these lasers based on how powerful they are. So the one this kid had was a class 3A or 3B laser. So power in terms of wattage ranges up to 500 milliwatts. And so the different warning labels on these lasers, they say with any sort of exposure to the eye, you can have damage. So obviously they warn you. I didn't see any of the class 4 lasers available on Amazon, but you can very easily buy class 3.
What are the red ones, the little?
The reds are.
Much weaker.
Yeah,
So
those
the green are the higher.
would be 3A, though. They're usually 5 milliwatts,
Mhm.
1 to 5, so they'd be 3A.
So
Yeah, they're usually 1 to 5. They're
The little
the
red-
laser pointers are 1 to 5. I actually have some 10s right here. They use the green ones, but yeah, the reds, but it's also red's a lower energy. Too.
Yeah,
Right.
So
Red is
it's
lower
not-
energy.
yeah.
Wasn't there a story recently of somebody like shining a laser at a plane and they like got the pilot or something?
Oh, it's still legal to point at pains. Yeah, people do. Most states have a law. Actually, there's.
They got
Yeah,
arrested. Purposely trying to-
Yeah, no, it's
Oh,
a felony.
Oh, is it? Yeah.
That's what they have them.
fast?
So I have some stuff on.
Oh.
So there's federal regulations, but there's also state regulations. There's only 12 states that have additional regulations on these lasers, and actually Florida is one of them, which was somewhat surprising to me. So here is the laser,
Only
23 bucks on Amazon.
Good time. Yeah.
So really, and it's easy to buy, so.
And it's also Amazon's choice. That's why I thought they might have a case, like the fact that it's bought up is with the Amazon's choice and all that. I wonder, I don't think they pursued anything.
So easy for
Same
any
day delivery.
any sketchy person to just go out and buy and kind of wreak havoc on the community or the retina, including Dr. Nittman. Anybody recognize that? So that's from our senior video last year. Matt actually bought one of these lasers. And I brought a prop today.
Oh.
So this is the laser. I'm not showing.
Oh, wow.
So you can actually see it like through the air, like through the medium. which
That's bright.
kind of
That's really
demonstrates
bright.
how
Wow.
powerful it is. I
You
won't,
guys have a
Really?
power meter? You might have one in the department.
we probably do.
For
So
calibrating, it'd be interesting to put that in a power.
this is the exact one, basically, that the
Wow.
kid has. It averages from like 60 to 90 milliwatts. It can be seen up to a mile away. And I tested that last night and it's true.
So I also have one of those and they're very fun. When I was living in St. Louis, I lived by campus and 15 miles away from the arch.
Mhm.
And we would go out on my balcony and point it on the arch.
And you
So
can see it?
Yeah.
That's why men shouldn't be
Yeah, this
president.
is, I know, I was like,
So-
the common denominator here.
So this one is supposed to go up to like
So
90
15 there, 15
milliwatts.
back.
Yeah,
Yeah, that's right, yeah.
but I think one Amazon purchaser did use a power meter and they recorded at 150. So you see these regulations are a little loose at times.
And because when we do macular laser, which you don't do much, it's usually, you said it about 50 milliwatts. You know, we don't do 150 milliwatt spots in the macula.
So when I was going to pick up the laser last night from my dealer, I was at the park. And you can kind of see, oh gosh, what happened? You can kind
Oh,
of see
yeah.
the line of the laser and
Wow.
I very easily hit any building I wanted to. And I was like, okay, I gotta stop because.
It's addictive.
Yeah.
So I measured it, like I was standing there. Here's the building. You can actually see it when you like zoom in on this photo.
Really good.
It's with ease, like with ease. It was remarkable. And now is
Where are you
like,
standing to get that angle? Like where are you?
I'm just
Oh, you're just like.
standing in the
your
road
eyes
and I'm like that, and then I took a picture.
out.
So, and that was 0.4 miles away. I could
Is this like
hit,
a drug dealer? You go on the corner? and
basically, it was
it's
kind of
like this,
sketchy. I
it's
like called Matt. I was like, hey, I'm in the parking lot. He pulled up in his car. He was actually shining the laser at me like through his car.
Oh, great.
So it just goes to show you like, obviously guys are gonna would be affected by this more.
Male predilection.
100%. So signs and symptoms. Back to the boring stuff. Obviously symptoms vary widely depending on how much exposure. Patient can be asymptomatic. They can have central vision loss if it, damages the fovea. Transient and even permanent scotomas. And then as well as metamorphopsia, just chromatopsias. And where you saw
And
the,
typically they have some linear, if you look at the very first color photo, which I don't even go back to it, but
yeah, we have.
there were a couple linear, which I told the parents, that you
Right.
must have tremendously steady hands.
Could be a future
Because most of his were
surgeon.
spots.
You should be a-
He would have made a good
Except for
surgeon,
the
except for the fact you bought him this laser.
So, OCT, I think, is kind of the best imaging modality for this, other than your DFB colored fundus photos. You'll see this focal disruption of the ellipsoid zone and RPE loss. With FA, which we didn't have an FA in this case, you can see delayed lobular hyperfluorescence and then your window defects from the RPE atrophy. You can also do full field multifocal ERG to kind of aid in your diagnosis. You'll have obviously preservation of normal retinal function, except for the areas of focal injury in the macula. Prognosis is favorable though. Most often these will resolve after several months, but of course that's dependent on how strong the laser is, how long the exposure was. There are some studies that suggest that oral steroids can help reduce the kind of cellular inflammatory response and reduce the damage to the retina. But I don't think that's been proven in clinical trials. And if the damage is bad enough, it can potentially induce or lead to a macular hole, an ERM, and even choroidal neovascularization, so you treat that appropriately. Yeah, that's basically it. It was a fun case though.
Now, they're getting more common. That's why I would never
They're so
recognize
easy
it if
to
I
buy.
hadn't seen them in meetings and everything. And because, and it's interesting, in this case, the parents were actually almost elated because they'd been reading about Stargardt.
Yeah.
And this kid came in after seeing a couple of
That's what
different
I
people
thought.
thinking he had Stargardt and he was like a permanent thing. And they said, no, he shot himself with a laser. I said, well, that might not get worse. I said, yeah. And they said, oh, good. I was like, yeah. Yeah, if you
Wait,
look at
so-
that early photo. I'm gonna go-
That's like
But they were
your
trolling
back-
innocent
back
parents.
is
They
around
got,
50. No.
they thought it would be a safe product.
Yes, yeah, which is, I mean, I could, if I was a kid. If this one, a couple of these are linear, like that one's a little linear, but usually there's more. I heard of one